Good day to each and everyone. This morning, I will be talking about the risk communication and community engagement on COVID-19 vaccination. The COVID-19 pandemic is a rapidly evolving situation and takes on different patterns in countries and communities, and it is therefore imperative that RCCE plans are adapted to the local context, reviewed frequently, and updated as needed. So, RCCE is an essential component of a broader health emergency preparedness and response action plan. For public health emergencies, such as the COVID-19 pandemic, risk communication includes the range of communication actions required through the preparedness, response, and recovery phase in order to encourage informed decision-making, positive behavior change, and the maintenance of trust. In introducing the COVID-19 vaccination, it requires a robust plan to generate demand and increase uptake. So demand generation is the key pillar in the government's vaccine deployment plan. So the goal is for high acceptance and uptake of COVID-19 vaccination among eligible populations and strong support from the community. So that is why program managers and national regulatory authorities working with a communication task force must be ready to engage effectively with all concerned groups like the parents and guardians, communities, and the media through strategic communication. So risk communication and community engagement for the COVID-19 vaccine deployment aims to achieve the following. Number one, generate demand and uptake for COVID-19 vaccine among eligible populations. So while managing expectations from the people who don't fit to the prioritization criteria, um, we want the eligible populations to come to the health centers or clinics to get vaccinated. Number two, build community trust and confidence around COVID-19 vaccine and the vaccinators. Three, address vaccine hesitancy and mistrust. Four, encourage the public to continue practicing COVID-19 preventive actions even after the vaccination. Here are some of the challenges that we will take into consideration when planning and implementing the demand and generation of the COVID-19 vaccine. Number one, supply is inadequate, hence prioritization of eligible population. So we have to let the people in the community understand that the COVID-19 vaccine will not be available immediately for all. Thus, we have to make sure that they will understand, accept, and support the prioritization criteria set by the government. So number two, eligible population involves adults who have preconceived ideas and beliefs about their own health. Number three, communicating the effectiveness of COVID-19 vaccines while also asking people to continue practicing preventive actions even after vaccinations because some people might believe that they will not be affected by the virus after they have been vaccinated. Number, strong public interest long before vaccine introduction. And lastly, proliferation of fake news and misinformation about COVID-19 vaccine. So, fake news and too much conflicting information greatly affect people's attitude, motivations, and intention to accept the vaccine. And also, it can erode the people's confidence to get the vaccine. So, we need to make sure that we have the eyes and ears in the ground so that we can be able to stop spreading the fake news and rumors before it will go viral. These are the six main pillars of COVID-19 vaccine communication. Number one, transparent and proactive. It means that we have to communicate what we know and what we don't know. Share information in a timely and proactive way, even in the context of uncertainty. Number 2, iterative. Strategies, plans, and activities are continuously reviewed and refined to meet the evolving needs of the communities. Timely, coordinated, consistent, and contextualized. All levels of government need to coordinate and share information in a timely manner, while recognizing that messages may need to be adapted to local contexts. Messaging should be consistent on all technical and safety issues related to COVID-19 vaccines. Data and evidence-driven. Strategies, plans, activities are informed by evidence on knowledge, attitudes, perceptions, and behaviors from multiple sources. Partnership-oriented and enabling. Partners, national, regional, and local, are regularly updated, topped, and trained if needed for synergy. Empowering and engaging. Communities that are empowered or engaged will be more likely to accept vaccines and support the strategy for the rollout. What are the components of demand generation? So number 1 is awareness raising and engagement, which includes activities for the eligible population. And this will ensure timely access for the activities in the community. Number 2, social mobilization. This can be in a form of dialogues with different partners. This can be the religious groups in the community or local leaders. So there should be community engagement. Number advocacy. This can be in the form of bilateral discussion and briefing sessions with the local officials. Community listening. This component is like an intel that you will allow to monitor on how the people are thinking and feeling about the vaccines, and we will anticipate on how to deal with it. Capacity building. It involves the frontliners. This includes training, planning, and coordination. This will help ensure that our plan will remain relevant to the needs of the community. Also, it ensures that our activities are coherent and messages are oriented. And lastly, crisis communication, which includes training for spokespersons in an event of a crisis that are vaccine-related issues. So we will be tackling about roles and responsibilities of health workers, vaccinators, and social mobilizers. Number 1, as the early recipients of the vaccine, vaccinators are the most trusted source of healthy information in the community, so we have to be the champions for COVID-19 vaccination. Number 2, we have to share accurate and adequate information about COVID-19 vaccine with the eligible population and other members of the community. 3, monitor and respond to questions, issues, and concerns of community members with empathy to increase trust and confidence in COVID-19 vaccination. 4, we have to actively monitor and respond to rumors and misinformation. 5, facilitate awareness-raising activities and community dialogues according to microplan for demand generation. So how to communicate effectively? So here are some tips. Number 1, listen actively. These are self-explanatory. So 2, welcome the vaccinee warmly. This is more on the vaccinator side or the health practitioners. 3, empathize with the vaccinee by demonstrating that you understand their questions, concerns, and how they feel. Then keep messages simple and clear. Speak in simple terms, using local and easy to understand language, and give examples that the vaccinee is likely to understand. So if Bisaya, we will use the dialect, no, para masabtan yun clearly. And then check for understanding. So after you communicate, mangutana ka, nakasabot ba ka sir, nakasabot ba ka ma'am? So inana lang. Then motivate the client by praising them for coming to the health center for immunization and encourage them to return for the next dose. Diba? Kay ang COVID-19 vaccination, kay 2 doses man sila. So i-remind lang yun sila from time to time. Then summarize what has been discussed at the end of the conversation. So, mo na lang gyud ta na. Nakasabot ta, sir, ma'am. So, mo na siya. And then use appropriate visual aids such as posters, flip charts, counseling cards, and pamphlets if available to support the conversation. Then, here are the key messages per phase. Number one is the top line messages. Number one, management of expectation. So we'll have to manage the expectation of the community, the people in the community. So number one is vaccines are not an instant solution to the pandemic. So ang imong supporting messages, ana, vaccines are an important tool in fighting COVID-19. But even the most effective vaccines will not end the pandemic on their own. So, mo na siya. Ang second na top line message is rigorous development and approval. The development and approval process for new vaccines follows the usual high standards for regulation of vaccines. So, supporting messages would be vaccines are an important tool in fighting COVID-19. But even the most effective vaccines will not end the pandemic on their own. So scientists all over the world are currently working hard to develop safe and effective vaccines to protect people against COVID-19. While some steps in the development process are happening in parallel because the need is so great, no steps are being left out, no corners are being cut. The studies taking place prior to vaccine deployment are as rigorous as for any other vaccine. The third top line message is the prioritization. So we will prioritize certain groups to reduce deaths and minimize transmissions among vulnerable groups. So it is important to ensure that those who are most at risk or most exposed receive the vaccine first. The first groups to receive the vaccines are number one, healthcare workers. Number two, frontline workers, including among others, teachers and uniform personnel. So, ang mga maestra apil na anino sa ato ang eligible or the first group to receive the vaccine. So, during deployment phase, the top line message would be patient follow through. So, example would be vaccines have very specific dosage requirements that must be followed for maximum protection. Be sure to consult a licensed health professional for guidance and care. So our supporting message would be COVID-19 vaccines will require 2 doses given at specific intervals. Your healthcare provider will tell you about the vaccine timeline when you go for your first COVID-19 vaccination. And vaccines have relatively complex mechanism, and having the proper information is crucial to getting complete protection. So consult with a licensed health professional regarding any COVID-19 vaccines before electing to get vaccinated. Another deployment phase top-line message is the acquisition of authentic vaccines. So COVID-19 vaccines have gone through stringent and comprehensive process to ensure their safety, and only authentic vaccines acquired through legitimate channels can provide this. So our supporting message would be certification and licensing process are in place to ensure the authenticity of any COVID-19 vaccine that will be made available to the public. So only COVID-19 vaccines certified to be authentic are able to provide full protection for those who are vaccinated. And lastly, for the post-deployment phase, responsible monitoring and cooperation. So the continuing safety and efficacy of this vaccine requires the cooperation of the public. So vaccines are a net positive and require stringent monitoring procedures to ensure their continuing safety and efficacy. So post-deployment is sense of community. So being vaccinated does not immediately grant protection for the whole population. So your adherence to established health protocols is still required to secure the safety of the public. So our supporting messages would be herd immunity will only apply once a significant portion of the population is vaccinated. Even then, it will be dangerous to rely on this as our first line of defense against the pandemic because the immunocompromised and high-risk sectors will still remain at higher risk. So, in introducing the COVID-19 vaccine, there are hesitancy or refusal that we will encounter. So how we will communicate with it. So I will be giving scenario and what will be our response or our communication response. Number one, when we encounter a person who is not eligible, comes to the health center and insists that he or she should be vaccinated. So example, maadto to sa clinic or sa health center no for employment travel and wala siya na-include sa eligible population. So what would be our response is to acknowledge and appreciate the person's interest in keeping herself or himself and her family healthy. And of course, explain that the current eligibility criteria does not indicate that he or she should get the vaccine at this time. So encourage him or her to inform priority groups that he or she know to come to the clinic for the vaccination and remind him or her about COVID-19 preventive measures. And if available, provide information on when the vaccine will be available to non-priority groups. So, inform lang niya ninyo ma'am or sir if nanay vaccine for kanang sa dili na eligible no nga population. So, for sure, ato lang po silang make sure nga nakasabot sila and maka-accept sila sa prioritization criteria. Next scenario is, a person who is eligible for vaccination does not want to be vaccinated. So, kanang eligible siya pero di siya ganahan. So, unsaon man na nato. So, understand the reason for hesitancy or refusal by asking questions and listening actively. Then, share relevant key messages including benefits of COVID-19 vaccine and risk of not getting the vaccine. So point to source of credible information and influencers. If still unconvinced, tell the person to consider vaccination in the future and that the health center is ready to vaccinate anytime he or she decides to accept the vaccine. Another scenario is fear of side effects. So, mao man gyud mao gyud ni usual nga hesitancy nga nung dili ta magpa-vaccine because we are afraid og unsay side effects because we all knew that this vaccine is kanang bag-o pud ni siya nga vaccine, bag-o na introduce. So, what we'll do is to explain the possible side effects and what the client or guardian can do to manage them. If information is already available, be specific in citing the severity and duration of the side effects. So the side effects of the vaccination will be discussed by our next speakers. So emphasize the benefits of COVID-19 vaccination. And another is fear of injection. So no, wala man yun siguro tao nga di mahadlok og injection. We'll just explain that the discomfort or pain caused by the injection is temporary and that the benefits of getting vaccinated against COVID-19 now far outweigh the discomfort or pain. So, inglo nang gud nimo gud nga kanang sakit jud siya ma'am pero matolerate ra gud siya. Mura ra gud siya og kusi or pinaakan og hulmigas. No, so yun ana lang we have to make sure to use communication skills para sa makasabot sila and then dili po nato sila banghagan no because para ma-accept po nila unsay atong dapat i-communicate. And then eligible person prefers a specific type of COVID vaccine that is not available at the health center. So explain that the production of each pharmaceutical company is still constrained given that the problem and need is in response to a pandemic and the country has to procure from those that are WHO pre-qualified as well as who can provide the exact number of doses we need. And before I will end my topic, let me give you the phrase, coordination is the key. So mixed messages create confusion and mistrust. So thank you and good day to everyone.